A few days ago, William Hague, the UK Foreign Secretary, made it clear that Britain was willing to up the level and type of equipment it was willing to supply the Syrian rebels. Well, today he put a little meat on that bone.
It will certainly include, for instance, armoured four-wheel drive vehicles to help opposition figures move around more freely, as well as personal protection equipment including body armour.
William Hague's also gone a step further, promising that if things don't improve in Syria, then there could be more coming from Britain and perhaps the rest of the EU.
The international community cannot stand still in the face of this reality. Our policy has to move towards more active efforts to prevent the loss of life in Syria. And this means stepping up our support to the opposition and thereby increasing the pressure on the regime to accept a political solution.
Well, Brigadier General Salim Idris from the Free Syrian Army has made it clear he wants the embargo lifted on arms from Europe to his forces.
To stop killing, to stop destruction and to fall this killing regime, we need tools.
Well, a very unfortunate milestone was reached. The millionth refugee from Syria is registered with the UNHCR. They're coming to camps all over the region in Turkey, Lebanon and particularly to Jordan.
We've had 1 million people, Syrians, coming looking for support, protection and assistance. And the international community has not woken up to the seriousness of this crisis. When will it? Will it be 2 million people or 3 million people? We are in a major crisis situation.
Inside Syria, conditions are deteriorating almost by the day, particularly the medical infrastructure, which has been under attack from the government, according to the opposition forces. Médicos Sans Frontières has opened hospitals where it can, but says it's under pressure too.
Doctors Without Borders has conducted over 1,600 surgical interventions in clandestine hospitals, so we're having to work in very hard conditions. We've installed hospitals in private houses, in farms, underground hospitals, for example, because of this clandestine way of working and the fact that Damascus doesn't authorise us to work in the environment. It means that general healthcare needs are not being responded to, so the healthcare system has collapsed. A lot of the medical staff have left, and a lot of the hospitals and clinics have been targeted. So ordinary pathologies, diabetes, cardiac problems, but also just giving birth has become a real issue inside of Syria today, because there's no medical facilities if you have any form of complication.
The problem with this entire crisis in Syria is that there is no clear end in sight. No political nor military solution that's obvious, and in the meantime, millions of refugees, ordinary Syrians, suffer.